The incidence of colorectal cancer is highest between the age of 50 to 80. Because of this, many colorectal societies and cancer societies around the world advocate the use of screening methods beginning at the age of 50. I am slightly against this because I think that one should not concentrate on detecting cancer, but one should concentrate on preventing cancer. So how is prevention done? I advocate doing colonoscopy at the age of 35 to 40, which is a good 10 to 15 years before the highest risk of colorectal cancer occurs. Now, if we screen at 35 to 40, doing a colonoscopy, we can see benign polyps. No matter how big they are, we can easily remove them through a simple checking colonoscopy. Now, by doing this, these patients will be saved from colorectal cancer 10-15 years later, because removing these polyps will prevent the polyps from developing and turning to cancer at a later stage. Now this, I think, is a much better method because we prevent cancer and not detect cancer. Now, however, many people do not come for early screening and they present only because they have symptoms. Now, what are the symptoms of colorectal cancer? Now, before I go into symptoms, let me just say that we do not want to wait for symptoms to occur before we start screening. The reason is 60% of all patients who present with symptoms arising from colorectal cancer are already at an advanced stage where the cancer is spread beyond the confines of the colon and rectum. We can easily understand what sort of symptoms these are if we imagine the colon to be a long tube, which actually it is, and which transports feces from one end to the other end to be evacuated out of the body. Now, this flow of feces, if it is unhindered, there will be no symptoms. And therefore, if the tumor is small, it doesn't block the passage, there's hardly going to be any symptoms. When this tumor grows bigger, firstly, it may cause a bit of obstruction. So patients will start complaining of increasing constipation or difficulty in passing motion. Secondly, if the tumor is bigger and the feces is forced through, it may actually abrade the surface of the tumor and leading to some bleeding. So patients may see a bit of blood, or else the patient may complain of some mucus discharge. Now, as the tumor grows bigger, there will be more and more blockage. So patients start getting bloatedness, increasing cramps because the colon starts to contract more strongly to try and evacuate the feces. So these symptoms actually are signs that we should investigate the patients further. Other common symptoms are a change in the character of the bowel, becoming smaller, thinner, or a change in the frequency. So patients may pass more frequently because less stools go through each time, so they have to pass more often. And all of these symptoms should indicate to the patient that they should see a doctor to get further testing done.